Greetings, everyone, and thank you for joining me on this bonus episode of the podcast. So there's no music, no intro, nothing fancy. I literally just wanted to come on here and share an announcement with all of you. Some of you, if you follow me on social media, if you follow any of our accounts, or if you are on our email list, you may have received something in an email announcing a new podcast that we are just launched this week, actually, or if you're following us or engaging with us on any of our accounts on social media, especially on LinkedIn, because that's where we primarily spend our time, then you will have seen some posts and announcements about this new podcast. Well, I want to share with all of you who listen to the Public Health Epidemiology Conversations podcast, but are not maybe on social media, or maybe you haven't seen our posts, or maybe you're not on our email list. I want you to know about this new podcast. It's been a long time coming. Honestly, I've thought about it and dismissed it because I thought, this is insane. What am I doing? I cannot launch another public health podcast. But actually, I made the decision late last year. And once I made the decision, it seemed perfect. Essentially, I want you to understand that this podcast will continue as it has been. I'm excited because I get to lean in even more and go more deeply into all things public health epidemiology conversations with the amazing guests that we have on this show, the applied work that people are doing, the applied lessons and the conversations that are happening on this podcast are helping us to just be our best professional selves and to connect with others that are in our niche areas or that are just interesting. We'll continue to share more about clients that we serve, these BIPOC organizations and these, large nonprofits and just large organizations that are really genuinely looking to connect with BIPOC communities. We'll continue to share some of the stories and client examples and just those types of conversations that bring public health to life and keep us connected and keep us moving forward on all things public health. So if you've been following this podcast for a while, you know that I also bring on a lot of consultants and entrepreneurs. We host a program called the Public Health Consulting and Entrepreneurship Expo. We've talked about it over the years on this podcast, and I've often shared topics to support entrepreneurs and people that are curious about that journey, because that's something that we get so many questions about. So this new podcast has been created to serve that topic and those people that are interested in that topic. It's gotten so much traction and I get so many questions and so many people are interested that the best way for me to really serve is to launch that podcast. So that was what I meant by it's been a long time coming. And once I made that decision, it just seemed really perfect. So the whole first quarter of this year, my team and I were planning behind the scenes without even telling you all what was going on. But we were planning to launch this new podcast, and we planned how we needed to fine-tune our systems. Actually, we started planning at the end of last year because we fine-tuned a lot of our systems for this current podcast and then make plans for the new podcast in this first quarter. And officially launched it this week. So at the time of this bonus episode, you're getting this on Friday, April 5th. We launched that new podcast on April 1st. So, and it has its own website and everything's in full speed ahead. And trust me, behind the scenes, it doesn't matter sometimes how much you plan and how much you put into it. Things are just a little hectic at any launch. You all know that if you think about any programs you've launched or anything that you've launched, no matter how much you plan, it's just a little extra hectic in that first week. So that has been the scene, but it's still coming together quite nicely. So if you are interested in the topic of public health entrepreneurship, if you're a public health entrepreneur, if you're curious about it, if you want to become a public health entrepreneur, or maybe you just to be clear, there's a lot of questions being answered, and this could be from people getting started, or maybe you got started and you're a little stuck, all the way up to people who have full businesses and are thriving and growing. There are resources and topics that cover people at all these different levels under this umbrella of the public health entrepreneur. And the way that we've launched and with the way that we've traditionally held our public health consulting and entrepreneurship expo has changed and will change. So we'll cover all of that on that podcast. We'll talk about all of those things on that podcast. And it gives us a wide open platform to really dive in and really get all into the topics over there on that podcast, separate from this podcast. So some of you are interested in both, and that's great. But some of you are more interested one versus the other. So I know there's some overlap, but they are different. So I want you to just know that resource is available. There's a lot of excitement generated as we started to tease it a little bit leading up to the launch and now in this first week. So the title of the new podcast is Public Health Entrepreneurs with an S. The website, which you've heard us refer to plenty of times in previous promotions, but the website is publichealthentrepreneurs.com. So once again, it's publichealthentrepreneurs with an S.com. That will take you to the website. You can connect to the podcast, the resources we have. The podcast is available in all of the main podcast apps, in Apple Podcasts, Spotify, YouTube Music, most of the podcast apps that you typically would listen to. If you search Public Health Entrepreneurs, you'll find it, but you'll also find links to the main ones from that website. I encourage you to check it out. If you like that, if that's something that you're excited about, please share it. I think that's probably my biggest ask of everyone is to just share. Even if this is not your thing, you're not really an entrepreneur, but you know other people that may be. If you just share it so that others can discover it. And we think of public health as it's a big community, but we're really a small community of professionals in public health, and everyone sharing will make it. Make it easy for other people to find. Just like I started this one, I start that one with answering the questions that I receive most frequently. And that's given us a whole lot of information to roll out. So we're hitting the ground running and fast. So if you're interested or if you're curious, just explore. I make it freely available so that everyone can explore, find what they need, and share the feedback. My only ask is that you help me share this podcast with your network so that more people can discover it. That is it. I just wanted to share that update with you. So thank you for listening to this bonus episode. I like to keep you all in the loop of what's going on. And remember to share the Public Health Entrepreneurs podcast and website with your network so that people can discover that resource. All right, everyone. Until next time, have a fantastic rest of your day.